Bonjour, Vardians. Here's a question of the day. Respiratory therapies can work in which of the following settings? A. Diagnostic laboratories. B. Sleep disorder centers. C. Patient's home. D. Educational institutions. Or E. All of the above. The answer, as you know, will be at the end. Hey y'all, I hope you're well. Welcome to another episode of Healthcare Boulevard. This is a podcast where we shine more light on healthcare, and our goal here is to provide more options to people looking to choose healthcare as a career path, regardless of their background. My name is Sena Kakpomo, and I am your host and creator here. I thank you for tuning in. I appreciate your support. Remember, you can tune in on YouTube or wherever you get your podcasts. Without further ado, let's get into today's episode. Welcome back, Vardians. It is Saturday afternoon over here, and we are diving in with another episode, another interview. We are here with a respiratory therapist. Her name is Natalie. Let me introduce her and let's get started. Natalie, welcome. How you doing?
Hi, I'm good. Thank you for having me.
Of course, of course. Let's start with you telling us a little bit more about yourself.
So I am 32 years old. I began the medical career early. I was actually somebody that knew I wanted to practice medicine. I just wasn't exactly sure the specific route I was going to go. But I started college at 17 and quickly went into EMS work, and then went back to school 4 or 5 years later for what I do now, which is respiratory therapy. And there's a lot more to that I'm sure we'll dive into in part of this talk.
Awesome. So I did notice on your LinkedIn profile that you've been on a journey getting here, like most of us in healthcare. So you were in EMS. Tell us a little bit more about how you found yourself here. What was your educational and professional journey before you even went to respiratory therapy school?
Yeah, so I little background on me, I guess. I actually had a childhood illness that I have not had to deal with in a very long time. It was just a childhood based illness. So at a very early age, I knew I wanted to help sick people. And so I began with EMS because I had a friend who was a little bit older than me, and he had just gone through it. And I was like, you know what? I love the aspect of adrenaline, and let me see what that's about. So I went into the EMS program, started work on the med unit here in the county we live in for about 4 years. I didn't do firefighting, I just did the med unit. And emergency medicine has now taught me that it was a wonderful place for me to begin, because it just gives you this broad spectrum of how to handle and understand almost any medical situation going further into your career, whether that's a doctor or a nurse or respiratory therapy or whatever you do in medicine. It's important to know how to handle an emergency. They're going to come up. So that helped me a lot when I went back into respiratory school. Respiratory therapy, I actually went back thinking I was going to enter the nursing program. This was 2013, and I'm out in Atlanta, near Atlanta, Georgia. Very competitive. I don't know if other states and cities have, I'm sure, other competitive programs that are hard to get into. At the time, even if you had a 4.0, not to say it didn't matter, that does matter, but there were so many applicants that there were already more applicants than they could take that all had 4.0. So it was at that point, it became experience or maybe an interview or, you know, whatever your other expertise was for them to look at you. And so again, I just met someone in the college, some adjuncts that were we call those, like a assistant to the teacher, assistant to the professor, I guess, from EMS school already. I went to the same college, and they were like, hey, just come talk to us about respiratory therapy. We don't have as many people applying as we thought, which I don't know why. I don't know why that was. So I got in, and ironically, in EMS school, you go through all these different chapters, obviously, and different tests. And my lowest score was respiratory in EMS school. And so I was like, are we sure I'm going to catch on to this? This is ironic. And I had an amazing professor with a 100% pass rate as far as taking the state exams, which prerequisites for respiratory therapy are basically the same as RN. But the program is obviously very pulmonary specific based. Right. And I've loved it ever since. It's just, a lot of people aren't as familiar with respiratory therapy. And so they don't, obviously people know doctors, nurses, they don't know that in the ICU, every patient is assigned, yes, their own doctor, their own nurse, CNA. You're actually assigned respiratory therapist in the ICU to every patient as well, even if they're not on a ventilator. So a lot of people are unaware of what I get asked the question, what does a respiratory therapist do?
Yeah. And let's segue right into that. You tell us, how would you define a respiratory therapist?
So it does depend on where you work. Same as a nurse, there's so many different things you can do, whether you work on the floor, the ER, the ICU, a rehab unit. So many different things. Mainly, obviously, you administer nebulizer medications and things of that sort, and then oxygen, and then obviously getting more advanced, you deal with a lot of ventilators, trachs, and suction, and then getting even more advanced machinery that they call oscillators and all these other different things, arterial blood gas, that you look at. And a lot of physics and math is actually involved in the ventilators and all the different I guess parts of the body, just to keep it general and easy, so to speak, that all relate to your breathing and your lungs. So you can also do home health, which is what I do now. I was a respiratory therapist in the hospital in the ICU, and now I do home health, which is a big population out here of mainly geriatric COPD. And so, what they call the baby boomers grew up smoking, that they literally rationed cigarettes to the military like they did food. It was like just as important as food. I mean, I remember growing up still with restaurants here smoking and no smoking sections. And, they didn't get rid of all of that until the last couple decades. Wow. So everyone that is in their 70s, 80s, and 90s that, maybe didn't ever quit, or they still smoked for many decades, now you're seeing all of these patients on oxygen, on nebulizers, on non-invasive home ventilators that are like a BiPAP, and it's everywhere. So it's very busy. There's a big need for it.
Yeah. So how long did you stay at the hospital, and what was the reason for your switch?
So that's a great question. I know I started at Scottish Rite, which is part of Children's Healthcare of Atlanta. There's a couple different facilities here, Eggleston and Scottish Rite and Hughes Spalding. And so I worked with pediatrics. I got an internship when I was still in respiratory therapy school, and I did my clinicals there. And that's how I kind of knew, okay, I want a job here. So I instantly knew just from my clinicals in school, this is where I want to work. This is where I want to be. And then I also wanted some adult ICU experience as well. And so I worked at the pediatric hospital and also the adult hospital at the same time, part-time and PRN each. So I had no plans of leaving the hospital at all. I was very happy. I loved it. I wasn't looking for a change of job at all. And, you stay, when you learn in the medical field, you kind of stay active on all of these things. That's how we found each other, whether it's LinkedIn or Indeed, or your resume's out there, your credentials are out there. And that's what's beautiful about the medical field. You can go anywhere. There's a lot of, sometimes that makes it hard because you're like, well, where should I go? There's a lot of roads.
Yeah, you have a lot of options. Yeah.
Yes. So I just got a phone call one day offering me the job I have now, and I turned it down. I was like, I'm sorry. I'm, I don't need that. I've never done home health. I'm happy at my hospital jobs. He called me back a few times. And just to be personal, a lot of my faith in God was why I'm at where I'm at. I just kind of followed a prompt. I didn't have all the answers at the time, and now it makes sense. So I had no idea what I was going into doing home health. My father had done home health with physical therapy, so I talked to him a little bit, but all I knew was emergency medicine, ambulance, hospital. I didn't know what this home health thing was about, how it worked. So I just learned. I've done this for 6.5 years, and I love it because you're so personable with your patients. They're almost like their adopted daughter, adopted granddaughter, the family. You see them all the time, and you see them in their home. So hopefully that answers the question. It just all kind of fell into place. So
yeah.
What are some challenges you face as a respiratory therapist overall?
So definitely, and what everybody mentions now a lot, obviously, was the coronavirus pandemic that hit now a couple years ago. A lot of the challenges for me here have been staffing. We're short-staffed, whether that's from people changing careers, people deciding to travel because the money is better, or just simply burnout. So I've kind of been working 3 people's positions for a few years now, and it's been very hard to keep up with that. A lot of hours, and just, I have to handle my own stress so that I can continue to do what I do. But the biggest challenge has been the need for staff. So we need anybody that is listening that is a student or thinking of being a student in any type of medical profession. We need you. People need you. People will always need healthcare workers. That is something that will always be job security and will never change. And we're always striving to have more and better clinicians. You're always learning. Medical field is definitely a constant learning environment. So
yeah, definitely second that. You won't be dry. You won't be left dry. That's for sure.
No, not at all.
And what has been some of your favorite part of your career?
So right now, my favorite part has just been when you can really feel the appreciation from a family, maybe a patient and a family member. A lot of what I do now, part of the population is financially burdened. So, whether their only income is Social Security, and that's all that they get. I've literally had patients tell me, I've got to sort out how many groceries I can buy or be able to purchase my albuterol breathing medication, and I'm not taking my treatments as much because I can't afford them. And so a lot of what I try to help with, I also volunteer at a clinic for that sometimes. That's honestly my favorite part. I don't want anyone to ever feel like they cannot have something they need because they're sick because they can't afford it. So we do have financial workshops and things like that we offer. And I just personally like to do and offer those things. You know, if I have a way of helping someone, then I'm going to do it.
Yeah. And so you as an when you finished school and then you went into respiratory therapy program, was that a bachelor's program or was that a master's program?
So respiratory therapy here was actually an associate's. You can get a bachelor's, and that's getting personal. I should have gotten my bachelor's degree. I started college young, and it's hard at 17 and 18 years old to be as disciplined as you should. Looking back, I took enough courses to obtain a bachelor's degree and still only finished with my associate's degree at the end of my medical profession. I did. And so I have thought of, you know, work-life balance. It's hard with kids and just working a lot. I've considered, you know, should I go back and get more? I've definitely had that in the back of my mind for years now, just because I did go to college for about 5 years with everything that I did, and I've maintained a lot of credentials, but I would just have to figure financially and time-wise how to make that happen.
Right. Yeah. And then, I mean, it's much harder to do once you already started living and you have other responsibilities besides just yourself, right?
Yes.
Like you mentioned, kids and family and financial responsibilities, because now when you were in your early 20s or teenager, or maybe even late 20s, your bills are not the same as they are now.
No, very much not. I thought, you know, looking back when I was in college, I was like, oh my goodness, that's going to be my salary when I get this degree. I'm going to be rich. And now I'm like, no, that's not. I mean, you know, you still strive for a good career and definitely strong finances, but yeah, it's funny, at a young age, I thought I would have, you know, all this money, I guess. So yeah, your responsibilities grow as well. So.
Right. So as a respiratory therapist, you told us a little bit about what you can do and the different aspects of health that you're involved in. What are walk us through some of your day to day, especially now that you are in home health?
Yeah, so our particular practice, in the morning, I do have patients that come to our office, and we're not a sleep lab, but we do set up CPAPs and BiPAPs for sleep apnea patients in the morning. That's usually not as much of our geriatric population, and you know, we see them maybe once or twice, and then they follow up and continue with their physician. And then midday and afternoon, I do a lot of driving. We go out and see our repeat non-invasive ventilator, a lot of COPD. I have some trach patients and restrictive disease patients. So patients with maybe MS or ALS that have the need for a non-invasive ventilation device because their diaphragm or muscles or neuromuscular disease, you know, they're weak to be able to breathe on their own all the time. I go see all of those patients. I go to the hospital still in our area occasionally when there's a discharge and they need to be set up on new equipment, and they would like for either the suction or trach or ventilator to be kind of taught and set up there before the patient goes home. It just depends on what doctor. We have about 15 to 20 doctors' offices. We cover a big area. We have probably 3 counties, maybe actually 5 counties out here. And we service the 2 most populated counties in the state. So we're very busy and always getting new patients. But day to day, that's basically in the morning. I still go to the office each morning, do our sleep therapy, and in the afternoons I see all of our chronic patients. And then a lot of talk with our physicians. Most of our doctors there's some family medicine, but most are pulmonologists or sleep lab medicine is most of our doctors, and they refer over to us.
Okay. So then you find yourself, of course, working in a team with the providers, yourself, the patients, and then any other therapists that may be working with alongside in order to sort of alleviate or treat or
Yes.
just manage the conditions. Is that correct?
Yes, it is. And, you find yourself trying to advocate sometimes. People's home life and home situations are very different. I see some where they have a big family, they have many caretakers available. Some patients can't even go home because they will have nobody to assist them and can't afford 24-hour at-home nursing care. And so they may go home, but then their ability there, they really need to be in a rehab unit, and trying to kind of identify with that when you're the only maybe clinician walking in that home when they go home for a few days is important too. So it definitely takes a team with everybody.
And I'm sure you've had to deal with the headache of insurance and what's covered and what's not covered.
Oh, yes. I've learned all about that. I never knew in the hospital, didn't have to deal with it. We had social workers, whoever else. I didn't have to ever touch insurance. I could just treat my patient and, work my shift and be gone. And home health, oh my goodness. I was like, I feel like I'm bending over backwards to try to get insurance to cover this or that. It's a lot of work. It's a lot of work. Yeah.
Now, seeing that you are clearly very busy, especially in this time when you're doing the work of 2 or 3 different respiratory therapies combined, how are you keeping or managing or coping with your burnout or professional tiredness, essentially?
Well, I feel like I'm a veteran at that. I've been in the medical field, even though I'm young. I've been in here 13 years, and I feel like I work well under pressure. I work well under stress. However, recently, and my husband probably would not, if you were on here, he'd not agree with it now. It's been hard. It's a challenge. I cannot sit here and say, oh, well, I just go do this and then I'm good to go again. You're going to have days where you can sometimes be in tears because of the stress or the pressure, and that's normal. You're a caretaker for everybody else. Oftentimes you forget to take care of yourself, and it's important to do that. I have to remember that I cannot do everything, and so to be satisfied at the end of the day with what you were able to do, you still did everything you needed to do. And just because you couldn't fix every single problem for the day, it's okay. And you can't carry that on into the next day, because stress is an illness in and of itself. And, you can't help more people if you're becoming so drained that eventually you won't be able to be there for them anyway. So it's definitely important to I'm a big advocate for sleep. Good sleep. It doesn't always happen, but people do not realize, and especially working with my sleep apnea patients, it was funny because when I first started, I was like, why does everybody in the morning that comes in here, my patients they're all seem grumpy. They're so grumpy. And it dawned on me one day, all these people are sleep deprived. No wonder finally they can get some sleep. They'll get on this sleep apnea machine and they'll maybe get some better sleep. I was like, no wonder. So whatever it is to take care of your body, mentally, physically, spiritually, whatever that is for somebody, is so important. And it's easier said than done, but consistency. So, you can't be worried that you had a bad day. There's always the next morning where you can start over again. You can't let setbacks just push you back all the way. You've just got to keep on going. Just consistency doesn't mean that everything's good all the time. It means that you never stop trying. You still keep going. And so that's basically what I do.
Yeah, no, I feel that. And we've heard a little bit about your educational journey, but in general, what are some growth opportunities that you've known in your field as a respiratory therapist?
So I actually had an interview somewhere last week that is a big growth opportunity. Whether it's going to happen or not, I'm not sure. It's actually a physicians group that was built by and for physicians, and basically it's still home health, but what the goal is to keep patients from being readmitted to the hospital and kind of helping the physician's office following up with the patients in the home to make sure they're actually following through with their therapies and not having to see their doctor and go to the hospital even more. And so that opportunity for me, if I were to go work with that group, I would be directly working with physicians, which I don't do now. And so it's a very big group out here, and they've doubled in size of how many doctors are a part of that group in the past, I think, 5 years. So a lot of virtual education as well has obviously become a huge thing during and after the pandemic as well. So there's just a big need for patients kind of fell off the wayside, so to speak, of being compliant. So that's what a lot of it's about too. It actually is about putting money back into the physicians' offices and back into being able to care for more patients, because you're following through with these patients after they go home. And so they're not getting all these readmittance fees because they're not actually doing their therapy, and then they're sick again and they're going back to the hospital again. So that's an opportunity for me that I am striving for, is to maybe work with that group. I don't know what will happen yet, but I'm waiting to hear back. So
okay. And so this seems like it's more focusing on compliance of the patient, depending on what their recommendations were, what the decisions were that was made for them to do at home. Okay, that's very good. So it's more so of a preventative, but not really type of thing, to preventing future complications, which is very nice.
Yes,
this is very nice. So I can see the growth in that. Lastly, before I let you go, any word of advice for future respiratory therapists?
So respiratory therapist or any upcoming clinicians, my advice would be, just things like this. You never know who you can meet, how many people you interact with, and who that person knows, and then that person that knows that person knows. My advice is just don't close up. Be open, even if you don't want to share your own experiences that are too personal. Maybe listen to others. You never know what network you can build, and it doesn't matter if they live right where you do or not. My advice is really just teamwork with the medical field right now. We all need each other. So your respiratory therapist needs your nurse needs your doctor. We all need to be able to work together better every day, and everybody can bring something to the table. So it's good to listen, share, both is my advice, because that's what makes a better healthcare team for the patient at the end of the day.
I appreciate that. That's very well said. Well, Natalie, thank you so much for joining me on this very beautiful afternoon on your very busy schedule. I really appreciate you sharing your experience and knowledge with us. I really do. And I know you were busy, and so I even more so appreciate you taking the time. Thank you so much.
Thank you.
Of course, of course. Have a beautiful weekend and hopefully you get some sleep, Hazard.
I will.
All right, Natalie. Take care.
Bye.
Bye.
All right, the answer is E, all of the above. Respiratory therapists can work in all of the stated locations, including, of course, A to D. All right, I hope you all enjoy the show. Again, thank you for all you've done, following, listening, sharing, and caring, and joining me back again for the second part of Healthcare Boulevard 2022. Bye. All right, that's all I have for you today. Thank you again for joining me. I appreciate you. Please subscribe, follow, like, comment, and share. And stay blessed. Bye.